What are we starting with?
I'm just doing some assessment for
For pecs. So lay down.
No, sit please. To start.
Okay.
Okay. Assessment for pec minor and pec major. You can start by palpating the tendons of pec minor bilaterally from behind the patient. You can get a quick sense of if one side is tighter than the other. Posture for both will be internally rotated shoulders with that head forward posture for pec major and minor. And if you could just sit and turn to that side for a second. If pec minor is really short, you might see the inferior angle of the scapula protruding out as it pulls on that coracoid process. Okay, and the other way again, please. Range of motion restriction for pec major will be this horizontal extension, as well as decreased scapular adduction. So if you try to pinch your shoulder blades together, good, and relax. And pec minor, again, a common complaint is they're unable to reach behind and back themselves, like they were trying to reach something out of the back of their car. Okay, on your back, please. Looking for pec minor impingement. It's a test called Wright's hyperabduction test, similar to the Adson's and Allen's test. We're going to take the radial pulse and bring the arm up into full abduction and slight extension, just pushing down towards the table. I'm feeling for a decrease in that radial pulse. You can also perform this test seated, bringing the arm up over the person's head, but some people criticize that because of the influence of gravity, which will decrease the pulse either way. Pec minor length test. If you look at the patient from head down, you can get a quick, easy view of both shoulders and see how much protraction they're sitting in. So you may see one side sitting up much higher on the table. Typically you should be able to fit about 3 knuckles under, comfortably under, but this is variable between people, so always comparing bilaterally. Pec major length, if you could put your hands behind your head like this. Okay, the elbows should be able to touch the table or almost touch the table easily. Someone with short pec major, you'll see something more like this, and you might see one side raised up higher than the other. Again, a good way to compare bilaterally. And you could slide to the edge of the table, please. And further looking at pec major length, the arm should be able to extend below the edge of the table easily. And you can test at different levels of abduction to bias different fibers. And sit up once again at the edge of the table before Mr. Rowan starts crying too much. One more test to look at for pec major shortness is internal applies. So if you reach your hand behind your back and try to touch the shoulder blade, they should be able to perform the applies test contacting the contralateral inferior angle without the shoulder girdle listing forward. Okay, so if you see that listing forward, that's indicative of a shortened pec minor. Okay, and then lay on your back again, please. In the last video, it cut out before I showed you some strategies for warming up in the pec major and pec minor. So this is a good place to do some cross hands, stabilizing at the shoulder and sternum, and spreading. Some people find it painful with pressure directly on those bony prominences. So if they're saying it hurts, make sure you ask them why. And if it's just from pressure from your hand, try readjusting your grip. Shearing off of the clavicle. Doing a shape and mold, reaching up underneath the border of that pec, grabbing the belly of the muscle and twisting in the direction of most restriction. Our bear claw hand grip that we talked about a few classes ago, getting the fingers like this, and then sinking in off of that medial border of the deltoid slowly. Using your body to turn. You can perform a cross fiber friction or a superficial fascial technique. Sorry. My wife is sensitive. And then if you wanted to do any kind of active treatment in here or some movement, you can find those tender points or those trigger points, pin them in a shortened position, and then either passively lengthen through different ranges, or get the person to actively lower their arm nice and slow for 2 or 3 repetitions.